Joined earlier when we were doing our test trial. I'm so glad you guys came back. Okay, let's jump right in. What in the... I'm gonna have to bring back cussing for this episode because I don't know what's going on in the world. But if the world... Oh, Quinell, I wore this shirt for you, honey. I don't know what in the world is going on, but baby. So guys, hey Ashley, hey Amanda. So guys, this is season 3, chat number 2. Today is Mind Your Own Womb, a conversation with board certified OBGYN Dr. Terri, who will join us very shortly. Let's start from the top. Hey Yanni, you up? Okay, mother. So if you guys hear baby in the background, he's not asleep yet. So here we are. So Mind Your Own Womb is a term coined by Carmen, who just joined us. Here by Carmen D. You'll see her name in the comments. She coined Mind Your Own Womb because people were all in her business. Carmen is over 30, just like the rest of us, and doesn't have children yet. And obviously we know how it goes. You know, why don't you have kids? When you having kids? Why you getting married? Da, 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 da. And meanwhile, people don't know that she has been suffering with fibroids for years. So that'll be a topic that we definitely cover tonight. But Carmen decided to come up with a Mind Your Own Womb. And she has mugs and shirts and bags. And I'm not sure if, Carmen, if you're still selling them. Oh, my God. I could not find my shirt tonight. So this is why I'm in this piece. I don't know where I put my shirt. I'm supposed to have my Mind Your Own Womb shirt on tonight. But here we are. It's a little old, so I definitely need to get a new one. You know, when the letters start breaking up, because I'll be wearing my shirt, honey. But yes, so shout out to Carmen. Me and my friends were trying to think of a topic for tonight, and I had women's business, and then I was like, trash. And then I had stay out of women's business, and then my friend was like, oh, how about you do mind your own ... body? And I was like, oh my God, mind your own womb. Like, Carmen has that. So yes, Carmen said that she's revamping. So we'll all get new shirts. I need me a crop number to show off my little baby fat that I have while I'm breastfeeding. But let's jump straight into it. Today, the CEO of United Healthcare was shot and killed in Midtown Manhattan. For those of you who do not live in New York City, it's like, that's like being like shooting in Times Square. Like, what the hell is going on? For someone to kill a CEO at 6:40 in the morning in Midtown Manhattan, they want that man gone. And I truly feel sorry for his family. Like, family, nobody should be killed. Y'all out here playing God. It was an investors meeting, and somebody didn't want him to meet with an investor. Sad and scary. Think about the people who were also on the sidewalk. This man had a silencer, shot a couple of times, then hopped on a bike in an alley and dipped. He's been practicing this. This is not his first hit. When I tell you guys that Scandal ain't got nothing on, the show Scandal has nothing on This Is America, nothing. Hey, Chrissy. Hey, Mel. So that was the first healthcare tragedy of the day. We're already living in a healthcare tragedy, but let's do one piece at a time. Blue Cross Blue Shield has decided they will no longer cover anesthesia for the full length of certain surgeries in Connecticut, New York, and Missouri. I'm laughing to keep from crying because what? What do you mean you're not going to cover certain anesthesias? And guess what, guys? Just guess what they're going to try to cut first. Hey, Dr. Vanita. They're going to try to, like, I feel like abortion is going to fall under one of the categories that they're going to not cover. How do you only cover half the anesthesia? So who covers the rest? Because what is that bill? Yeah, I need to figure that. We need to figure that out. That's developing. Because what? Like, I cannot imagine, and I know a lot of you in the chat have done it, have these kids naturally. If I didn't have my anesthesiologist, I would have survived. Yeah, I get it. You cover the rest, but like, have we seen a medical bill before? I think to have a baby is like $150K. So I think the anesthesia is about $50K of that. How does that make sense? I needed my epidural immediately. I cannot imagine not having anesthesia. I don't know how my grandmother had 6 kids in Haiti in her home. Like, she was wilding, because I would have not been having sex ever again. Hey, Brianna. So today's is so good that we're, yes, Dr. Terri, epidural is a godsend. Today is actually cute that we're having this conversation about women's health and minding our own wombs, because last year, I took a pregnancy test and found out that I was pregnant with my son. And then 2 days later, Justin and I had celebrated our 4th wedding anniversary. And now this time around, we'll be celebrating our 5-year anniversary this Friday. So shout out to our friends and our therapists for keeping us together, because never would have made it. No. I'm not going to sing the rest for y'all. Y'all know the vibes. But here we are. And as I explained to you guys on my last conversation, that during our last chat, during my 28-week visit, my doctor was like, she had me set up with... hold on a second. Babe, can you close the door? She had me set up with a high-risk doctor because I was over 35. I would have been over 35 once I had my son. So during one of those visits, she then tells me, like, did you know... What did she tell me? Sorry, I'm getting so distracted. He's crying, and it's like my brain is like... So during the 28-week visit, my doctor was like, oh, did you know that you have a fibroid? They're going to check on your fibroid. So I'm like, a fibroid? I don't have no fibroid. So she's like, oh, yeah, it was 2 centimeters. They didn't tell you? Ma'am, you are my OBGYN. You are required to tell me. Like, so that just threw me for a loop, because I come from a family of fibroids. We have uterine cancer and other cancers that run in our family. So that's actually really nerve-wracking. But here are some statistics. Black women are 3 times more likely to die during childbirth compared to white women. If white women were dying at the rate that black women were dying, this would be a national crisis, okay? And if you need a reminder or an example, the crack era versus the opioid era, yeah. It's real out here, guys. We're not protected. They think that we're resilient as hell. None of us are that resilient. And as of 2021, only 10.7% of physicians of OBGYNs are black women. So out of 100% of OBGYNs in this country, only 10% are black women. Let that sink in. That's why we're talking to Dr. Terri tonight, okay? Because Dr. Terri is a part of that 10.7%. I was trying to find some newer numbers, but apparently they're still doing like research. So even the 2023 numbers weren't up yet. The latest data was from 2021. And tonight is literally about like asking questions. Like, this is a community. We're here together. We're here for another 45 minutes. And we're going to chat. Have any of you guys watched the documentary called Aftershock on Hulu? So Aftershock follows 2 men who have lost their wives or girlfriends either during childbirth or a few days after. I have somebody very close to me who lost his sister a few days after childbirth due to a blood clot that traveled through her body and obviously caused her to pass away. And that was devastating. Like, at the funeral, like, she's passed away, but her fiance was holding like a fresh baby. Baby had to be like 8 days old at that time. Like, beyond scary. So Aftershock follows 2 men and a mother who have lost their daughters or girlfriends. Shamani, Keisha, my friend Keisha knew one of the women who passed away. Just really sad. And a lot of these stories are all the same thing. Women were experiencing different symptoms. They were expressing these symptoms with their doctors, and their doctors were not listening. They were not trying to hear nothing. Like, One of the ladies, she had a baby, wasn't feeling well. The doctor sent her home. The EMTs, I guess she wasn't feeling well. EMTs wind up coming over, and they ask the mom, is she on drugs? Is she on drugs? Is she on drugs? Like, no, bro. She's dying, like literally dying. They spent so much time in the home asking is she on drugs instead of trying to assist or get her to a hospital, that by the time she got into the hospital, she wound up dying. They don't believe us. They literally don't believe us. They believe that we're resilient. They believe that we're lying. Terri Bowie was an Olympian who died of eclampsia at 8 months pregnant. It's a rare condition, and we can ask Dr. Terri more about it because I've never heard about it. Is he okay?
Yeah, I can move him.
Okay, you can look past. Sorry, guys. Real life happening over here. There's tape on the door. That's why I probably won't close if you put tape on the door. Sorry, guys. Back to reality. Serena Williams. After she had delivered her child, she had told her doctor that she was experiencing certain symptoms, and she knew they were related to, and we all know what happened after. Oh my God, Lynette, I'm gonna chat about you next. So Serena Williams also had a blood clot. She was experiencing symptoms of a blood clot, explained it to her doctor, like, listen, I'm an athlete, I know what this feels like. They're telling her no. She's telling them yes. Thank God she had the money and the fight, not the money, sorry. Thank God she had the fight and like just the will of herself to say, hey, I'm not bugging. I'm having a blood clot. I need an MRI. They then pulled her in and figured out that she was in line and rushed her into surgery. So this just goes to show you that even if you have money, they don't listen. You literally have to advocate for yourself. I am, as you guys can see, very boisterous. And when we were having Phoenix, I made it very clear to Justin, if something doesn't feel right, I need you to speak up. Because not that doesn't speak up, but he's not me. I'm not even letting you get past go. Okay. I was like, hey, if something seems odd, if I look out of it, I need you to speak up. And if that ain't going to work, call my mother and put her on speaker because this is not going to happen. One of our other friends, Lynette, she's in the chat here. Lynette lost her baby also, and she had to deliver her baby. She said that she went to the hospital. Let me scroll back up. This baby crying is really distracting me. I was late to a doctor's appointment, and we all know what happened after that. Like, it's just so sad. It's more common than you think, especially among Black women. Babe, you can take it out the water now.
It was frozen.
Oh, grab another one. It's going to take too long.
They all kind of frozen.
No, I know. There's milk all the way in the back of the fridge. Because the crying is distracting me. Okay, sorry. I'm back. Real life again. So it's more common than you think. The top 3 rates of Black women to die are cardiac arrest, childbirth, and homicide. I couldn't stand up without blacking out after I had my second kid and they discharged me. Wow, that's scary. Yeah, they're taught that we're stronger because we deal with pain daily and the average person cannot. So, with that said, I'm going to bring in Dr. Terri. Dr. Terri is she's going to give us the game because we need to understand what is happening in the world. As you already know, abortion was one of the biggest topics of this last election. And so it's a hot topic for everybody. I'm going to tap in Dr. Terri now. Terri is going to join us soon. Keep sending in everything. Was it due to an epidural? Hi, JJ. Hi, Alize. Here we are. Hey, Dr. Terri.
Hey, sorry, my voice is really weird.
It's okay. Listen, life is lifing. Thank you so much for joining us. Everyone, I met Dr. Terri in Waco through my mentor, Dr. Tyra, and me and Dr. Terri have been good girlfriends for the last 2 to 3 years. So, Dr. Terri, thank you so much for joining us tonight. And if you can just give us like a brief intro, obviously your name, how long have you been studying medicine, and why did you choose to be an OBGYN?
So I'm Terri Woods, and sorry, my voice. Uh, Military brat, and then ended up going to undergrad at Kentucky State and HBCU, and then medical school at University of Kentucky. I actually chose OB because it is the most unique patient population,
Mhm.
and what attracted it to me was that it was actually the only department in the hospital where people come to you for a good reason.
Wow.
So in
Hmm.
generally speaking, aside from all that you guys have discussed before,
Yeah.
the pregnant patient, they come to their doctor because they're happy. And usually pregnant patients are young, happy, and healthy
Got it.
in in general.
In general. Yeah, yeah, yeah,
Um,
yeah.
So that attracted me because I had my son in high school, so I was a parent when I was in medical school. So
Got it.
the pediatric department, I just felt maternally pulled, and it was a struggle
Okay.
to care for those sick kids. And then the older population was, it just was too much.
Yeah.
So I fell in love with OB because of the patient population. And it's unique also because you traverse the reproductive years with this woman, with this
Yeah.
patient that you deliver her baby. So you are there for significant and very important parts of her life, like delivering her babies. So, and sometimes, like with your patient, your friend that had the fetal demise, you have some sad parts too, or even
Yeah.
miscarriages. So you share a significant part of that woman's life, and that was very attractive to me.
Yeah. So I was going to ask you, for your patients who have had fetal demises, how does that affect you as a doctor? Does it make you cry? Are you sad? Like, are you able to stay strong? Like,
So
what emotions do
if
you go through?
so that's an excellent question because in residency I felt like I had all of the patients who had fetal demises. So I
Wow.
got really good at dealing with it.
Hmm.
And it's traumatic for the patient, obviously,
Yeah.
but it is also traumatic for her OB,
Yeah.
whoever that may be. And so in order it's very important for that person to be compassionate, to be, sympathetic, to try to make it as easy as possible. So if she doesn't want to feel anything, make sure that she's got all the pain medication that she can stand.
Yeah.
If she wants to not feel anything, support her in that. So however you can support her, it's real important to support her. And the biggest thing that I feel as far as that is concerned is to allow the family to deal with that loss.
Yeah.
It's not something that you're going to forget about easily. It's always going to be marked in your mind. It'll be a birthday that she will celebrate, even though she doesn't have a child to
Yeah.
celebrate it with. So you have to be cognizant of that. And the other part is kind of helping them seek closure. So you need to have, if their hospital has a chaplaincy, somebody to come from their own church or whatever their faith is, someone who can support them in their spiritual mindset, physically, obviously, which is what the OB is there for, and any other kind of way. And also, I found that whether she wants to initially or not, to have a discussion about what to do after the baby's born,
Hmm.
because you're just thinking, um, I'm going through this process
Yeah.
and I'm going to deliver a baby that's not going to be living.
Correct.
And so you kind of have to help them address that or at least think about it on some level and then come to a decision about, do you want to hold the baby?
Yeah.
Do you want, so there's a lot of
That's a
discussion,
lot.
and
Yeah.
it's a lot. And I feel like I got really adept at, and you kind of have to talk to them constantly
Yeah.
because this is a traumatic experience, obviously, but you want to let them know this is what the day is going to look like. This is how this process is going to go.
Hmm.
It could be longer than we expect. It may not be as long, but we're here for you the whole throughout.
Yeah.
And any questions, and they forget stuff because it is traumatic.
Of course.
So you have to come back, and if somebody new comes in the room, like if a family member comes in, You have to go and talk to them too. So you just have to be open to repeating everything,
over and over.
inform informing them. I am over informative. I
Yeah,
feel like a patient can advocate for themselves when they know what's going on.
yeah, absolutely. One of my closest friends who I met at work wound up becoming good girlfriends. Her name is Melanie. She carried a baby up until 27 weeks, and then this she had a short cervix, didn't know, had to deliver baby. Baby lived for 8 days and then passed.
Mhm.
And then when I got that call, like I felt like, oh my God, like I was dying. I'm like, I can't imagine how she feels. And that was before I had children. So when I got to the
Mhm.
hospital, like you said, her doctor was in there, asking us, did we want to hold the baby? And I'm like, I didn't want to hold the baby. Like that was a lot, but I now that I have kids, I'm like, wow, that was crazy. Okay, we got really heavy really fast, so let's bring it back. Dr. Terri, what is the importance of women going to their OBGYN visits?
So it's important because the one thing that's interesting about OB, and I don't think people realize this, we are a specialty, but we are also primary care, a
Oh,
primary care physician. We are a primary care physician for women.
for your
So
vagina,
if you
whole body.
for all the things
Woman,
that make you a woman,
got it.
from the time that you have your first period up until the time you have your last period,
Oh,
most women are going to see an obstetrician and gynecologist. Either when you're pregnant, you see the OB part, but same person.
yeah.
And then when you stop having babies, you see that person for your gynecologic care. And so we see women when they enter into the medical, when they enter into healthcare, we see them.
Mm-hmm.
We see them, and I want to just mention, I think I heard you say, just kind of a little plug, that there's 10% of women or 10% of the medical of physicians are Black
Yeah.
women.
Is it like,
The number of Black female OBs is less than 2%. So yeah, nationwide, we
wow.
are
So
a we are
maybe
truly
the
unicorns.
doctors and the OBs are 2% of that 10%?
About
Oh my God.
2%, yeah. So, and it's usually just slightly less depending on the year. But I'm sorry, I digress.
Okay. No,
But yes,
you okay.
so OBs are where women enter into healthcare. So, and you don't always see us, sadly. Sometimes you'll go to just a family physician or internal medicine, whatever the case may be, whatever your choice is. But to actually get specialized care for women, which I advise all women should have, you should really see an obstetrician and
Yeah.
gynecologist.
One of my friends asked the question, is there a way to tell if you have a short cervix prior to having a baby? I feel like the answer is no. You won't know until you have a baby. Is that
No,
accurate?
that's accurate. Yeah, you
Well,
won't know.
until
Yeah.
that baby's weighing you down, Nelly, you will not know how far your body can stretch. Um,
Right.
um, okay, another question for you. Fibroids, obviously a big thing in our community.
Mhm.
Why? How? What the
You
heck?
know, the fibroids are very, very common, very, very common in women in general.
Hmm.
And like you said earlier, which was exactly accurate, 3 times more common in African American and Black women,
Yeah.
women of color. We don't know why.
Yeah.
We don't know what causes fibroids. We don't know what causes fibroids to grow in some women and not grow in others.
Hmm.
We don't know why some women are symptomatic or they have symptoms from their fibroids
Hmm.
and others don't. But Black women tend to have more severe symptoms because of fibroids. They tend to have symptoms earlier because of fibroids.
Yeah.
They tend to be anemic, more commonly anemic because
Hmm.
of fibroids.
Hmm.
And sadly, they are treated more, I would say, dramatically. So, definitively, the diagnosis is via, you take the uterus out.
Hmm.
But there's so many surgeries or there's so many procedures or ways of treating fibroids before you get to that
Yeah.
point so that you can still have babies, obviously. And a lot of women, Black women, sadly, are moved directly to hysterectomy. And there's so many treatments
Right.
before that I think aren't
Yeah.
discussed.
Yeah. My mom, after she had my brother, me and my brother are 5 years apart. After she had my brother, she had a miscarriage. And then she got pregnant with me, and her doctor said, "Hey, don't get excited because you have a lot of fibroids. She may not make it." But God said, "Hello." But let's talk
Right.
about miscarriages too. I mean, let's go back. So obviously, we know that doctors, you guys study, you guys know this, but we also know that God does exist. So if there's a will,
Mm,
there's a way, right? Ain't no
right.
fibroid stopping what's meant to be here.
Right.
But let's talk about miscarriages because
Hmm.
I feel like that was like so. Not so taboo, but I didn't know a lot of women who had miscarriages until my best friend had one. Her and her husband were trying, or maybe they weren't. She had a miscarriage, and like when she was like devastated, I was like, wow, like this is actually really sad because once you hear the heartbeat, I never wanted kids, Dr. Terry. I tell you that already. But once it was the first appointment, I heard that heartbeat. I'm like, this is my
Hmm.
baby. So now I
Hmm.
cannot imagine how she felt hearing that heartbeat and then losing her baby.
Right.
You know why miscarriages are so common and not spoken about?
So I think it's a couple of reasons. I think for one, it's before the kind of most commonly pregnancy loss happens in the first
True.
trimester. And a lot of times it's, the egg, the sperm, they get together, the egg, the the pregnancy doesn't develop normally.
Mm-hmm.
Most commonly it's genetic
Oh,
stuff. So it just didn't come together correctly and the body doesn't recognize it as being normal.
got
Um, Other times it can be anatomic things. If there's, like you said, if you have fibroids on the inside in the cavity of the
it.
uterus,
Mm-hmm.
and if you think about where an egg would implant, it can't survive if it implants on a fibroid or near
Yeah.
one. It has to implant in that good muscle
Yeah.
because that's where the blood supply is. And even though a fibroid is a kind of muscle, it is not the same muscle that the uterus is. So, you hear, oh, a fibroid is a smooth muscle tumor, and the uterus is smooth muscle, but it is different,
Mm-hmm.
and it cannot support a pregnancy if a pregnancy implants on it or really close to it.
Yeah.
And if you've got a bunch of fibroids, think about it. If you think about walking on a cobblestone street,
Mm-hmm.
if you don't have your shoes on, think about how bumpy it is, right?
Yeah.
So if the part between the cobblestones is where the normal uterus tissue is, and that's where the baby should implant, think about if you've got a bunch of fibroids, where can the baby,
Oh,
where
that's
can the pregnancy
true.
implant?
Yeah,
Does that
yeah,
make sense?
yeah. That was a perfect analogy, actually.
Hmm.
Woo!
So if the if the fibroid is like a rock and the concrete is the softer muscle, if the pregnancy has to search and can't find it, then it's literally going to pass out of the body and it
Yeah,
won't implant normally or grow normally either. So
got it.
so there's lots of reasons. But the one thing I will say about miscarriage, which isn't spoken about, is that it is still a pregnancy. It is
Yeah,
still a loss. It
yeah,
is not, it doesn't obviously get as far along as say, like your friend who had the 27-week loss, but it is still a pregnancy. So she is still going to grieve that loss.
yeah.
She is still going to be sad. She's still, and the thing is that what I've always tried to do when I have patients, because women want to blame themselves. What did I
Yeah.
do? Did I
How did I
drink
do
too
this?
much coffee? Did I eat too much junk food?
Yeah,
Was it that one glass of wine I had? It most of the time you don't find a cause.
yeah.
Now, obviously, if you have them recurrently, you need to seek your OB and request an evaluation because recurrent pregnancy loss is a little bit more
A big thing.
concerning than a single one.
Got it. Got it. Got it. Woo! Okay, so Dr. Terry, my goodness, yeah, my mom, she had a bunch of fibroids. She actually had a surgery to remove some of them.
Hmm.
Where I was planted at, they were like I was in like a tricky place.
Mm,
So she did a bunch of times. She said she had so much nausea. She had a terrible pregnancy with me. She blamed
mm,
fibroids, but I think I was just a devil from the beginning. But yeah,
yeah.
speaking of like going into hysterectomy, I have a family member who she's special needs, I would say,
Mhm,
functional, But anyway, she suffers from really bad periods, so she has fibroids.
Hmm.
And I mentioned she's special needs because the doctor who she went to go see about her issue, the
Hmm.
first thing he said to her was, "You should get a hysterectomy." And she's like, "Well, I'm 38. Like, why would I get a hysterectomy?" So my mom is then like, my mom is a retired nurse.
Hmm.
She's like, no, call him, so like, blah, blah, blah. Call me when you're in the room with him so I can be on speaker, because they think that you are special, so they're
Hmm.
not taking you
Right.
serious. And it's like, that's not fair. They manipulate so many women who, one, don't have family, both of her parents are deceased. She's moved
Hmm.
from Florida to New York, has my mom to rely on, thankfully. But it's like, how do we get to a hysterectomy? He didn't talk about shrinking the fibroids. I don't know, deleting them. I mean, I know there's a bunch of things you can do. He just jumped
Hmm.
to that. Hey, number six. Oh, wait, really quick, ladies. If you have any questions, please put in the question box. You guys are asking great things, but I'm locked in right now. So put it in the question box, and then we will get to them before Dr. Terri gets up. So go ahead. What you gonna say?
Um, so the question is, why do they jump to hysterectomy?
Yeah.
Um, Sadly, I think it has a lot to do with the fact that that is the end of the end of the procedure. Like that is the last, that's the final thing.
Yeah.
Um, Here's the thing. I think if you really, 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 like if you come to if you've had 5 kids and you're
Hang
like,
it up. Hang it up.
this uterus is about to fall out and I'm sick of it.
Yeah.
You know, having that discussion about the final, the definitive treatment
Yeah.
is reasonable. But if it's your first entry, your first discussion, and that's the first thing that comes out of their mouth,
Mm-hmm.
you just need to go to see a different. Second opinions are
Yeah.
good. And
Yeah.
I need to impress upon your listeners or your viewers,
Yeah.
second opinions are good. Third opinions, if necessary. Fourth opinions,
Yeah.
because a fresh look at it is going to be to your advantage.
Got it.
And if you've been seeing, and here's the thing, if you've been seeing the same doctor for
Mm-hmm.
15 years, I just want to say, you guys are friends. You guys have a relationship.
Yeah.
And when a doctor feels comfortable with you, which is, I'm not saying that's a bad thing, but sometimes it means that they don't look at every
Oh,
option.
okay.
They're just like, oh, you just go ahead and have your
Yeah.
uterus out. And it's like, if that's and because you trust them,
You're gonna listen.
you're more like you're more likely to go, okay.
Yeah.
Always get a bunch of opinions. It's
Okay.
never wrong. And that doctor should not be offended if you're like, you know what, I appreciate your opinion, but I really want to look at other options. And if that's your only option that you're offering, I really want to go and talk to some other people. They can't be
Just
offended by that.
make sure. Yeah.
Mm,
If they're a true
mm,
physician, if they really love
right.
care for their patient. Um,
Right.
you are in the very red state of Texas.
Yes, ma'am.
How are you and your fellow physicians feeling about all the chatter of what's happening with just women's health care in general?
You it's interesting because here in Texas, you'll get some physicians that will, they're going to go to the mat for their patients. They're going to do the right thing. They are not afraid. They have spoken to the risk management people at their hospital, to say, look, I know what the laws are saying,
Mm-hmm.
but if X patient presents to the hospital with this situation, I'm going to treat her as I've been trained.
Yeah.
And some hospitals are supportive of that, but you have to have a conversation with your OB if
Mm-hmm.
you're considering pregnancy and live in Texas. You need to have an upfront, candid conversation to get an idea of what your OB is willing to do, what
Got it.
they can do. You know what I
Yeah.
mean? Like we're all aware of the laws, but some OBs are very they're in places where they're worried about legal
Of course.
ramifications, their medical license. If they're an older physician, they might just be like, nope, I'm not doing it because I cannot risk
My pension.
my the rest. my pension, my
Yeah.
retirement, my home, because they're coming. Our AG here
Mm-hmm.
is got two lawsuits right now
Dang.
of physicians for performing an abortion that he felt was
Wow.
inappropriate. So
Wow.
have to
Wow.
be have it. Don't be afraid to have a candid conversation. And more importantly, if you get the idea that your physician would be fearful of treating you appropriately, you need to find one that does.
Yeah. For those of you who are just joining us, we are chatting with board certified OBGYN Dr. Terri, who's out in Texas. And just a brief catch up. We have discussed miscarriages being common, obviously, any kind of fetal loss being devastating, no matter what state of is it just just gestation?
Gestation. Yes. Good
That word almost
job.
killed me. My God. um, and we also discussed getting second and third opinions. My friend Amanda wrote below that don't be afraid to go out of network. She paid
Right.
$50 that saved her life. She had developed Crohn's during her second pregnancy, and they were diagnosing her with everything but the damn Crohn's. Would Crohn's fall under you or no?
Oh no.
Okay,
That
okay.
is the bowel. We do not mess with the
Oh,
bowel.
get your bowels right, Amanda.
Right. But your physician should be able to refer you to a gastroenterologist or a colorectal surgeon, whatever you
Would
need.
having
Um,
Crohn's affect you wanting to get pregnant again?
it shouldn't. It
Okay.
shouldn't. I know I have several patients that have had Crohn's and had healthy pregnancies. Now you should also have additional care with like a maternal fetal medicine. It's more of a team approach. So if you've got conditions that make you high risk like Crohn's,
Hmm.
then you're going to see your gastroenterologist, your OB. You probably will see MFM, a maternal fetal medicine physician, who's just going to kind of monitor the growth of your pregnancy and will kind of coordinate care with your obstetrician and maybe even your gastroenterologist to ensure that you get the best care and that your pregnancy is uneventful. Because what we love, OBs, is
Yeah.
a uneventful pregnancy.
Listen,
Favorite thing, uneventful pregnancy.
when I went to have Maverick, they were asking me, "How was your first pregnancy? How was your first delivery?" And I'm like, "Oh, smooth, smooth, smooth." They were like, "Perfect. Let's get this girl to the room." And I'm like, "God." Uh, Second pregnancy, I feel like it's scarier because the first time you don't know, so you're scared for the fear of unknown, right? And
Hmm,
the
hmm.
second time you're more scared because you do know. Like I
Right.
did understand that, hey, I could be in here for 29 hours again. I was only in there for 16, which is still
Hmm,
crazy, but that was like pretty decent.
hmm.
Or you like, I could leave this hospital without a baby. Or Justin and the baby could leave the hospital without me. Like, whew,
Right.
just the
That's
idea.
scary.
It is
Hmm,
it is so scary. And
hmm.
my first time having Phoenix, I didn't tell any of my friends that I was in labor because I was so afraid. And I know
Hmm.
people took it personally, but it was like, it wasn't about them. It was like, you don't understand how scared I am. I'm
Right.
terrified. And even best of intentions and the best energy to for me and the best prayers, I cannot receive it right now because I'm shook to my core. Then I had a
Right.
baby during COVID, so my birth plan was that my mom, my doula, and Justin. And
Hmm.
then I was just not stuck with him because he the baby daddy, but I was just stuck with my husband. And it's like, you're cool and all, but you never had a baby, so I
Right.
don't really trust you. I want to be able to work. And then
Right.
my OB at the time was a man. So
Mm.
he, thank God, God works in mysterious ways because he wound up having a C-section, and I wound up having an Indian woman who I wound up making her my OB because I really loved her, and she delivered
Hmm,
Maverick. Um,
hmm.
but I was just terrified of not coming home.
Right.
I think the idea of losing the baby was still sad, but at least we could make another one. But if I'm not there, then how does that work?
Right.
So my OB this time was an Indian woman, and I love her. Like, it felt good to have a brown person on my team. But when she didn't tell me about that fibroid, I was a little bit pissed off with her, and I think she just was overwhelmed. But that was aggravating. But I do want to ask you a question. When you go to the hospital to have a baby,
Hmm,
they ask how many pregnancies have you had.
hmm.
So when I had Phoenix, I was like one. So they ask you the question, we want to count any abortions, miscarriages, etc., etc. I made it very
Mhm.
clear this was only one. They then asked Justin to leave the room. They asked me again. So I'm like, well, why did
Mhm.
he have to leave? Oh, a lot of times women don't want their men to know. Copy, right? Women keep secrets. They asked me again. This is the third time. Now, the fourth time, I was offended because I said I've never been pregnant before. Why don't they believe us even on the smallest things? Is it like, do Black women have a stigma of having the most abortions or whatever? Not that there's anything wrong with it. I've just never been pregnant before. This was my actual first pregnancy. And I just was
Mhm.
asked 4 or 5 times, like as if I could not comprehend what being pregnant meant.
That's that is called medical bias.
Ah,
It's bias.
yeah,
It is an assumption it is an assumption that is made based on race.
yeah,
Racial bias actually is based on race. They assume that Black women don't feel pain.
yeah.
They
Hello.
assume that there's some type of, like we are not telling the truth
Dr.
when we
Terry,
say, yes, this is my
sorry.
first.
One of my friends just said that she lied to her doctor, so she see why they ask you for it.
But here's the
Keep
thing.
going.
Your
Don't
what you
lie to your
tell
doctors, guys.
please
Please.
don't.
How
Please
can they
don't. It doesn't help.
be
It
lying?
doesn't it doesn't help you. It
It's like
doesn't
people
help you at
go to
all.
the therapist and lying. You cannot be fit if you lie. What's good
Right.
with you guys? Tell your man
We
the
we
room.
need all the information to take the best care of you. And if you feel like your doctor is going to judge you, then you need to go to a different doctor.
My
Because
and my first one, well, I was
mm,
recommended by my best friend. And
mm,
when I got there, I was like, oh, yeah, my best friend recommended me. She was like, oh my gosh, she has had so many abortions. I could not believe, because first of all, she only had 2 at the time. But I could not believe that was HIPAA. That was a HIPAA violation. Why would she
yeah,
say that?
that's not oof.
I mean,
That's
you're getting
oof.
scared, Dr. Terry. I'm glad you didn't say anything.
Yeah.
The
Yes.
girls want to know. All the girls want to know. So a lot of my
Mhm,
friends are my age. We're 35 and up.
mhm,
They don't have children, and they want to know. Do you have any tips or any positive words? We've heard we know it's high risk. We've heard all the negatives with it.
mhm.
What are the success stories of women over 35 conceiving? Are there any things they can do now to make sure they have a good pregnancy? I mean, I know obviously we can't predict everything, but what advice do you
Right.
have for 35 and up who want to conceive?
So if you truly are wanting to
Oh,
conceive
I'm
and
sorry to cut you off. First ladies, you got
mm.
to get a man. Okay, go ahead, Doctor.
Well, that not necessarily. There's
True,
artificial
true.
insemination. There's all kind of that. You don't necessarily need a man. You just need some sperm, but that's
Yes.
a whole different thing. Um, so when you are considering it, when you are considering getting pregnant, regardless of your age, go and see your gynecologist.
Hmm.
And so the optimal thing to do, the ideal thing to do, excuse me, is to, if you've got any medical conditions, like if you've got a little bit of high blood pressure, or if you've got high cholesterol, or if you're on medications that may not be safe in pregnancy, then you want to optimize those conditions, meaning get on a medication that's safe in pregnancy. Now, you can have high blood pressure during pregnancy, that's not an issue, but you want to be on a specific one that is safe if you decide to get pregnant. So you need to see your doctor before you're planning to get pregnant so that you can optimize your health so that you have a safe pregnancy. And then if you're concerned about, do I even know if I'm fertile?
Yeah.
You have those discussions too. And it's if you're concerned about, my family, excuse me, this has been in my family. I'm concerned about it. You have these discussions. So you just have to go to the doctor with the plan that I'd like to have this discussion about future fertility.
Hmm.
And please don't go to and this is not an insult, but you should really be in a specialist's office, meaning come to your OB. And if your OB can't address those or doesn't feel comfortable with those questions, then they can send you to a reproductive endocrinologist who are the specialist above us for infertility. But you also want to know that you have infertility
Yeah.
first. Because a lot of people come and they're like, well, I've never tried to get pregnant. So am I infertile?
Yeah.
There are tests that can be run to see if your ovaries are functioning normally. But it's more so starts with a conversation. And I know in this time that physicians are very quick to get you in and out, but that's where you have to tell them, hey, I need you to schedule me a little bit extra time because I've got lots of questions.
Mm-hmm.
Do your research before you walk in, have your questions ready, and pose them to your doctor. And if, again, they don't feel comfortable, like, this is out of my wheelhouse, this is not my specialty, don't be afraid to be referred. I mean, a referral is only going to give you more information. You're going to be going to a more specialized physician.
Mm-hmm.
Um, but ask questions, have a discussion. That is the first
Yeah.
thing. But I don't think there's any, given all of the advances that have been made in reproductive care. I mean, there are women in their late 40s, early 50s. If your ovaries are still functioning
Mm-hmm.
or if your uterus is still functioning, um, pregnancy is an option as long as you are cared for by the appropriate people.
Got it. We have another question. A friend says, outside of SSRIs, how can one maneuver through premenstrual dysphoric disorder? And ladies, this is a severe period. This woman has it, and her doctor put her on antidepressants. Is there anything else that she can outside of SSRIs? I think serotonin, some.
Yeah, so that's a difficult one because of the kind of premenstrual disorders, like the pain and dysphoric disorders. That's one of the more difficult ones to treat. So in that situation, you kind of want to go to almost like a reproductive endocrinologist because they're going to be looking at hormone things and they're going to be looking at specifically your symptoms as they relate to your cycle.
Mm-hmm.
And honestly, OBs, unless that's their kind of like they like that, we are generalists.
Got it.
I mean, we're specialized, but we are
Yeah.
generalists. So to have, if you have that specific type of disorder, you probably should have a specialist who's going to look at your cycles because what it is like that dysphoric syndrome, it happens specifically at parts of your cycle, and sometimes you can be on a medication during that part
Mm-hmm.
and not be on anything in other times. So you really have to have someone who is looking specifically at you. And this is not going to be, well, this is this disorder and this is how we treat it. It's individualized
Got it.
care. And if you're not feeling like you're getting that, you need to go to someone who that is their specialty. And I know I'm saying go to another doctor, go to another
Oh, it's
doctor, go to another
okay.
doctor.
Gotta do what you gotta
But
do.
it's a village sometimes. I know you know how we say within the black, it takes a village to raise a kid.
Hello.
Sometimes to have a healthy pregnancy, it takes a village of
Yeah.
doctors. And if you can find a doctor that looks like you, who can address your cultural concerns, your spiritual concerns, although, like I said, you said 10%, and I told you we're less
Ooh.
than 2. Um, seek them out, seek them out, and try and get somebody who looks like you so you can feel like your concerns are being
Yeah.
addressed
That's
wherever they might
the
go.
hard part is finding a black OBGYN who is covered under your insurance. I see two people in the
Hmm.
comments said that they had OBGYNs that they liked and then they quit. That happened to me. My guy, I thought I liked him. He moved and I found a better one. I guess OBGYN is also like a therapist. You got to date around, but show your, that's a lot.
Well, I mean, I I will say a good, if you find when you find a good one, stick with it. Stick
Yeah.
with them
Yeah.
because in my profession, not all of us are very
Mhm.
good. We might, and because somebody is super smart does not mean that they're great with people.
Correct. We
So
know those people. Work with those people.
yeah, we work with those people. Like, I've had people in my medical school class that were top of the class, but could not interact with
Yeah.
people. It takes the bedside manner is huge, and that's where you get that relationship, that interaction, because That you want somebody who can explain medical terminology to you in a way that you can understand it. If they
Yeah.
can only speak medical speak to you, that's not who you want, because you're going to leave there and you're going to be like, I don't know what he or she just said.
Can you?
All he threw at me was a
Yeah. Can you take antidepressants while sorry.
pregnant.
Are are there pregnancy safe antidepressants? Do you,
So as a class, antidepressants are all they used to have this kind of category A, B, that kind of thing. They kind of did away with that. Um, Here's the thing. When I remember how I just said it's always a discussion.
yeah.
So it's really risk benefits. So if the risk of your depression in affecting your pregnancy is high,
Mhm.
then there is more benefit to being on a medication.
Got it.
That's how you have to think about it. So you need to have this discussion about the risks of medications, because most medications have been tested,
Mhm.
antidepressants. There's a lot of medications have been tested, but not necessarily in humans, in
Yeah.
obviously. So there are some correlative things you can see in animal studies and things like that. But sometimes you kind of have to look at it like, is it safer for her to be on this medication
Mhm.
than to be off it during her pregnancy?
Got
And you just have to have those discussions.
it. Way
So
the
all of them as a class are considered safe in pregnancy, but some of them have different risk benefit
Mhm.
profiles. So those are the ones that you're going to have to talk to your doctor and say, I was on this before pregnancy, and is that safe for me to continue in pregnancy? One thing I will say, because a lot of people do this, they you're on a medication, you're on several medications or whatever the case may be. You get a positive pregnancy test and you're like, "Oh," and you quit all your medications.
Don't do
Don't do
that.
that. Don't do that. So you need to, as soon as you find out you're pregnant, and if you're on medications that you don't know, that are, if they're okay in pregnancy, call immediately. Which
Mhm.
is why I'm going to rewind back to, if you are thinking about pregnancy, seek out care before you get pregnant if you've got medical conditions that are concerning, because optimizing those conditions, being on appropriate medications as you prepare for pregnancy, because you're essentially preparing your body to
Yeah.
carry a pregnancy, you need to have that discussion. Be like, hey, I'm on this, and this. Is it okay to take these in pregnancy? I'm considering getting pregnant. But sadly, as some of us don't plan, and if it happens, just call. Say,
I
hey,
planned the
I've
first. I was in.
yeah.
I have
So,
another
so as soon as you know, you should ask.
question. Can holistic approaches shrink fibroids? Do you know?
I so sadly, in most medical schools, now this is not true now. I think now they are doing a little bit more holistic medicine. We aren't really taught those things.
Yeah.
So when I was in med school, I didn't learn about alternative medications or alternative things.
Mhm.
I kind of had to pick that up on my
Got
own.
it.
As it stands now, I mean, there are lots of reasons why, say, African American women are at higher risk of having
Mhm.
fibroids. Can you change some of those? Some of those you can't. Like, we can't not be black.
Yeah.
So our risk is still going to be 3 times as high. But say, for instance, being over your ideal body weight
Yeah.
can affect your fibroid growth on some level. We
Got-
don't know the level, we don't know the amount,
Yeah.
but so losing weight sometimes can help.
Mhm.
Optimizing your medical conditions like hypertension puts you at increased risk of having fibroids.
Got it. Diet is a big diet,
So
right?
so when you say holistically, I'm just going to say there are some risks
Yeah.
that you have
Mhm.
that put you at higher risk for having fibroids. So if you can mitigate those risks, which is a holistic
Mhm.
approach, then yes, to some extent, yes, you can.
Outside of birth control, are there any other natural medic well, yeah, natural medications that can help people with cramps, like during like their periods? Do you know of anything
Um,
organic natural remedies to help with very painful cramps?
there are, and they're skipping my, they're, I,
It's okay. You can
like,
always
I,
circle back to me and I'll let the girls know.
yeah, I may have to look that one up because there are a few things, and it's more like newer things. Like I feel like I've read about some teas and different things. Here's one thing that you please stop doing. Like, and I don't know why they even started this. Stop doing those vaginal steams. Just stop it.
My mom made me do that after I had the baby. She said she wanted me to
Mm-mm,
keep my husband. She a damn fool, huh?
mm-mm. Just,
I had to
just,
do it for 3 days. Very Haitian. I was on a bucket, burning my
I
damn vagina.
don't. There's
Are they useless?
they are. It doesn't do what no, no.
Okay, ladies, put the vagina steam away.
Stop
All
it.
right,
Just stop
Terri, I have
it.
another question. Should you be trying to conceive prior to testing your ovary functionality?
You mean as far as if you're over the age of 35, or
Yeah, if
what's
you're
the
over the age of
okay?
35, should you try to get pregnant? Well, yeah, yeah, obviously, right?
Not well, yes. So infertility is a retrospective diagnosis.
Yeah.
So meaning you try without now obviously if you're older, you're going to be trying for a shorter period of time. So if you're less than 35, you should be trying for at least 12
Mhm.
months without any contraception and all that. Um, and then if you can't get pregnant on your own, then you are then seeking out an evaluation to see what's going on. And
Okay.
I will say, as soon as you walk in the office, it never fails, about 50% of the time. I've been trying to get pregnant, and you show up and you do a positive, you get a test in the office and it's positive. It just
Oh.
never fails. I mean,
Yeah.
it's bizarre. But you're going to be trying for a certain period of time on your own,
Yeah.
and then if you don't successfully get pregnant, then you can seek out evaluation. But that time frame is dependent on you. Like if you want to wait a year, if you're less than 35, that's kind of like the diagnosis. Or less than if you're over 35, it's 3 to 6 months. Or if you're like, you know what, I just want to know, go and ask. Like I said, always have a discussion. You always want to be with see a doctor who is open to hearing what you have to say.
Yeah. It's really important. Um, this question is great. Ashley, I'm gonna kill you. Out. How important are prenatal vitamins? I didn't take them during my first pregnancy and not taking them during my second. This is a good question.
So I'm gonna be honest with you. You could take some Flintstone vitamins. It
Oh,
doesn't.
really?
But
Okay, go ahead.
I but
Uh-huh.
asterisk,
Asterisk.
if you have some medical conditions that make you less susceptible to having certain nutrients. Like if your diet is poor, the
Mm-hmm.
prenatal vitamins just give you
Got
more of those nutrients that you may not be. So you can a lot of times you can mitigate the prenatal vitamin because I know the things are huge. I think they've gotten them a little bit smaller, but it's like a horse pill. I was just
the
like,
pack. The pack
this. I'm
has
sorry.
6 pills inside.
Yeah, yeah. It's
Well,
they're
I'm
just
my
gigantic.
postnatals. Yeah, they
Yeah,
ain't helping because my.
it's so if you look at what's in a prenatal vitamin and you can increase your dietary intake of those
Hmm.
things,
Oh, then it works out. Because
yeah,
our
it works out.
grandparents did potatoes, huh? And our parents came out fine.
Right,
So,
but I will say this, if you as busy as most of us
mhm.
are we eating appropriately?
No, and we don't even know what's in the foods. Look, the fruit is rotten at 24 hours. What's
Yeah,
going on?
yeah. But I and here and there's another little thing I will add. Little thing I will add. Oh gosh, where did that thought go?
It's okay.
I can't even remember. But oh, I know what it was. Um, if you're not eating it, you do not eat for two. I know we say stuff. I've heard people say that I'm pregnant, so I'm eating for two.
Hmm.
Mm-mm.
You
You're
eat it for
eating
one.
you're eating for one.
Yeah,
If you have twins, then you're eating for the additional. Then you are eating for two. You're eating for
got
yourself
it.
and the additional baby. But always, and here's the thing, I think that we as women generally don't do good self-care. Self-care also includes our diet.
And
And
rest.
so,
Rest.
and rest. So if you are preparing for trying to get pregnant, take care of yourself, change your diet a little bit, eat healthier.
Yeah,
All those things make for a healthier, safer, successful, happier pregnancy.
yeah.
But pregnancy in general is not a comfortable state. So know that your body changes. It's not comfortable. And
Months to carry a human is too long, honey. I
yeah,
was done after week 10. I think I found out about week 10. I was like, baby, I cannot. I was so sick. I couldn't even sit up. I was working like this, like literally laying down. I was done. So
yeah,
it's a blessing, but baby, we need to
yes.
make it shorter. Um, guys, we're a little bit over an hour. If you guys want to stay, please stay. We're not going to be too long. Dr. Terry, are you good? You got some place to be?
Mm-mm,
Okay,
good.
we have a few more questions. And
Hmm.
for those who are just joining us, in Hot Topics lately, if you guys have watched the Kiki Palmer interview with Shannon Sharp, she discussed having an abortion and how it was her choice because she just wasn't ready to be a mom.
Right.
If you're not ready, trust your body, believe yourself. It's a lot of work. It's 20. I have not slept since the day I found out I was pregnant. So I think that was December 4th of 2023. I'm exhausted. I'm so like even right now I'm tired. My breast hurts. Time to pump. It's a lot of work to be a mom. So if you think you're not ready, believe yourself. It is okay. Nobody's judging you, not these people. That's between you and God. um Kiki Palmer spoke about that. Trina recently put out an autobiography where she discussed having multiple miscarriages, and feeling ashamed and asking why and thinking that her body failed. She said her first miscarriage was with Lil Wayne, who already had kids, so she felt like less of a woman because he was able to conceive with other women. What made her not special? And if you guys know, back then they were engaged. So that was a big deal. And then a big deal for her because obviously we didn't know what's going on. And for those of you who watch Married to Medicine, our newest cast member, who I cannot stand, Sweet Tea, she deals with fibroids and also has issues getting pregnant. And I don't wish that on anybody who really wants to have a child. So we're here with Dr. Terri, who is a board certified OBGYN, and we're just answering a few questions. So this is an interesting one. What if a woman who does not want children, suffers from endometriosis, wants a hysterectomy? Will the doctor grant that, especially if she has ovarian cancer that runs in the family?
Yes. Sure. I mean, if that's, but this is what they call medical decision making. Like after a discussion between you and your physician, if that's the treatment plan that you agree on, then yeah, it's that's reasonable because endometriosis is a
Painful.
painful condition.
Yeah.
It's
Yeah.
unrelenting as long as you have the uterus and the ovaries there. Now the thing is, if you've got ovarian cancer risk, um, then having at least your ovaries out is going to decrease your
Yeah, that's
risk.
me. Ovarian cancer and uterine cancer run in my family, and
Mm.
heart disease. My side of the family, boy, they got everything. My dad's side of the family, they literally die at like 102. But my mom's side of the family, heart disease, ovarian cancer, uterine cancer. So should my doctor be doing any additional screenings for me?
So ovarian cancer, there's really not a proven way of screening for it.
Got it.
I know, Gil, you probably are too young for this, but years ago, Gene Wilder, who was married to Gilda Radner. I don't know if
Never
you know who
heard.
that is, but anyway,
I'm gonna Google the best.
so Gene Wilder was often in movies with Richard Pryor. That's how long that goes back. But anyway, so he was advocating for this one test that, blood test that is supposed to help screen for ovarian cancer. And it is not a screening test. It is literally after you've been diagnosed with ovarian cancer, it is one of those tests that you can look to see for recurrence.
Okay.
So there's really not, I mean, they don't advocate a pelvic exam, ultrasound. There's really nothing to screen for ovarian cancer in general. So you just kind of have to have these discussions again. I'm going to keep harping on having these discussions with your doctor
Yeah.
because if you are concerned, your doctor has to want to address those concerns. And then you discuss how do we go about allaying your fears. So is it something that okay, I could do a pelvic exam. It may not let me know that you have ovarian cancer.
Hmm.
Because sadly, ovarian cancer isn't found oftentimes until it's in
Right.
stage 3.
Damn.
So yeah, so it is one of those things. But if you have risk
Hmm.
factors, there are kind of recommendations on kind of things to do before to kind of mitigate that risk
Yeah.
essentially. So yes, you just have to have that discussion. And here's the thing, this is the one thing that I have always harped on
Hmm.
in the Black community, and I say this specifically for us. We don't often talk about our family history
Yeah.
because we don't know about it. You know,
Hmm.
big
Too many
my
secrets.
yeah, my big mama died of such and such. Well, what did she die from? I don't
Yeah.
know. Or you've got and I'm not just talking about medical conditions. I'm talking about mental health,
Yeah.
medical conditions, all the things. Even developmental delay sometimes. Some of those things can be genetic, and because we don't talk about them, we don't ask. Like, know your family history because
True.
that is the biggest advocate for you
Yeah.
when you sit in front of a doctor's office.
You're 100% right, because I dated a couple loonies, and I know they mamas and daddies had to be crazy, because ain't no way you set this man out into the world to come date.
But we have to have that discussion, and I mean
Yeah.
like like your great grandparents, like
Yeah.
what did they die from, or what did they have? Because we have so, and a lot of the time, and it's systemic racism, sadly, but in medicine, and a lot of racial biases. But we have to find out our own history so that we can advocate for ourselves
Yeah.
appropriately and say, my grandmother died from breast cancer at 40,
Yeah.
or my grandfather had breast cancer, but these are just not things that we often know about because we don't ask, and the elders don't tell us.
Yeah. This is a follow-up question from the hysterectomy one. Is there an
Yes,
age requirement to request a hysterectomy if you suffer from those issues?
I saw that question and I was actually going to address it, but I think we had moved on to another question. And technically, no, but some physicians, me included, are going to feel um, reluctant to do a
Hmm.
definitive surgery on someone who's very young. So if you've now again, if you had 5 babies and you're 29 and you're like, I have endometriosis so bad, and you have that discussion
Hmm.
and you guys talk about your options and you've tried other things and stuff, it's not working, then there really should not be an age requirement. But for you to come into your doctor's office at 29, having had no kids, say, I want my uterus out, I can tell you what that doctor's going to say.
No,
Right. They're going to be like,
because that's
no, hard stop.
I was telling my doctor, she was asking me when I was getting my IUD, did I want more children? And I was like,
Right.
no. Like, the answer is no. She's like, okay, well, do you want to tie your tubes? And then I had to think about it. I'm like, well, damn, that's so final. So do I want more children? I was like, the thought of not having the choice, like, I want to have the choice. Like, I don't want you to choose from me. So I got my IUD, obviously.
Mhm.
So we did a 10-year one compared to when I had feelings. I did a 5-year one because I knew that I wanted to have another one.
Right.
Um, but can I have two IUDs just to make sure it's locked in, or no? Okay, forget it. All right, this is the this is the last question. I was diagnosed with Crohn's right after I had my second daughter.
Mhm.
I lost almost 60 pounds between when I first saw her and when I had the baby. Was there any way for her to know from the symptoms that I shared with her?
With her OB,
Yeah.
that might be difficult because again, that's not our
Yeah.
specialty. And Crohn's does have some, it has some significant symptoms, and early in pregnancy, like it's like bowel issues,
Mhm.
and there can be other causes that we don't necessarily think about. Like, we think about the common stuff, but a 60-pound weight loss, ooh,
That's
that's
a
that's a
lot.
lot.
Yeah, when I
I
saw
would,
my, I was like, she was like a ghost. But you don't want to address people. So you're like, you okay, girl? And she's like, yeah. I was like, girl, is you okay? And then after, when she started gaining her weight back, then she was able to
Mhm.
tell, hey, went to a couple of doctors and found that I actually had Crohn's because her entire
Mm-hmm.
was losing weight when obviously women do the opposite.
Right.
And then you have people who say, "Oh my God, you look so good," and meanwhile you're like, "I hope I'm not dying." Like, my
Right. I mean, that's one of those, that's a difficult one because again, we are obese and we are focused on pregnancy, the uterus, the female stuff.
yeah,
So if there's something else going on, and again, if you are concerned and you express those concerns to your doctor, your OB specifically, especially if you're
yeah,
pregnant, and
yeah,
they should just refer you like, okay, well, let's refer you. Like this is out of my wheelhouse. And don't take your doctor wrong if they say, I don't know. That is
I
actually a sign of intelligence.
I appreciate that.
I say it all the time. It's like, if people come to see me, I start with, we're gonna start an evaluation. I can tell you right now, I can give you an idea of what maybe might be going on, but I can't say specifically.
Yeah,
And I don't want you to leave here thinking I know exactly what's
yeah,
happening with you, because
yeah,
this is the beginning of a road. An
Woo.
evaluation is a
Yeah,
road
yeah.
that you take to figure out and to find and get information so that you can know what's happening with
God,
you. It's not something that you show up and they instantly know. If they instantly know, you need to go to get a second opinion.
yeah. Outside of like women tearing during birth and their abs breaking, can we discuss these moles? Like, what? I'm so confused.
That's just character and age, girl.
No, listen, I was like, "Mom, I look like I'm mature," but I noticed like I after each pregnancy, I'm just growing more and more. Like I have a few on my neck. Is that pregnancy related?
It can be.
A
I mean, just like you have that like dark, like
line,
line down that line down your abdomen. Your nose will get a little
no,
darker, your neck will
big,
get a little
big.
darker. It's yeah, it's
It is.
it's all kind of hormonally related. Yeah.
Dr. Terri, I am so grateful for you. I'm so happy you were able to join. So, everybody, as you know, we usually do this on Thursdays, but Dr. Terri is a real doctor. And we are not getting in the way of anybody's health care because I'm like, it'll be my luck that somebody needed a damn C section at 8:15 p.m.
Right.
in Dallas time. So, we did it on
Exactly.
birthday. So I hope Jay-Z forgives us for being here. We got bigger issues than his birthday. But Dr. Terri, thank you so much. You are such a light. Like since the day I met you, you've just been my girl. And I'm so happy that
Ah,
you were able to spend an hour with us. And thank you, thank you, thank you. And
no
ladies,
problem.
if you have any questions, you can shoot them to me. I can ask Dr. Terri if she wants to share any of her information with you guys. If you have any questions.
And if you
But
want to do a part two, I'm open.
and we will have a part two. Come on, Dr. Terri. Yes. So everybody have a good night. Dr. Terri, thank you again. And guys, we will chat again in 2 weeks. And next, I'm working on having a session for the guys, for someone to come in and talk about men's health because Black men deserve to die old, okay? And we need to really get into what's going on because I'm not trying to be nobody's single mother. I need my man to live long, baby. Okay. Have a good night, guys. Bye, Dr. Terri.
Bye bye.